Good morning, ladies and gentlemen. I will be talking to you this morning about the glossopharyngeal nerve, the accessory nerve, and the hypoglossal nerve. The illustration in front of you basically is the inferior aspect of the brain, and it also shows the side of the face, and as such depicting the origin of the glossopharyngeal nerve from the medulla oblongata and the distribution of the glossopharyngeal nerve. Of importance is the otic ganglion, which is intimately related to the glossopharyngeal nerve and associated as such with the parasympathetic innervation of the parotid gland. Do not forget this. Another diverse illustration showing the distribution of the glossopharyngeal nerve and also the otic ganglion and also the relationship with the parotid gland. And this illustration shows the glossopharyngeal nerve and its innervation to the posterior 1/3 of the tongue and also to the tonsil and the tympanic membrane. Again, do not forget this. It is important that I very quickly talk to you about the functions of the glossopharyngeal nerve. It contains motor and sensory fibers. You must remember that. And it supplies its motor fiber to the stylopharyngeus. And then the secretomotor fibers, which I told you earlier on, that is parasympathetic, is supplied to the parotid gland, and sensory fibers to the pharynx, the tonsil, and the posterior part of the tongue. We're going to look at the sensory nuclei. The sensory nuclei receives the central process of the unipolar cells in the superior and inferior ganglia of the nerve. The fibers concerned with taste end in the nucleus of the tractus solitarius, and the fibers concerned with common sensation end probably in the nucleus of the spinal tract of the trigeminal nerve. And remember, my English ends probably. So another illustration of the origin and the nucleus of the glossopharyngeal nerve. You can see here the nucleus of the tractus solitarius, the solitary tract itself, and its relationship with the chorda tympani, which is a part of nerve 7, the facial nerve. And you can see the distribution to the tongue, and that is the anterior part of the tongue. We're going to look at the motor nucleus of the glossopharyngeal nerve. This is formed by the rostral part of the nucleus ambiguus. The glossopharyngeal nerve, or the glossopharyngeal part of the nucleus, I must say, is the nucleus ambiguus, sends its efferent fibers to the stylopharyngeus. Additionally, parasympathetic fibers will join the motor part of the glossopharyngeal nerve from a representation of the general visceral efferent column, which is termed the inferior salivary nucleus. And here you can see the diverse distribution of the glossopharyngeal nerve with the superior and inferior ganglion and its distribution to the common carotid artery, the tonsil, the posterior one-third of the tongue, and the pharynx. The motor nucleus of the glossopharyngeal nerve lies in the reticular formation below the superior salivary nucleus, and it sends fibers via the tympanic branch of the glossopharyngeal nerve to the lesser petrosal nerve and the otic ganglion. The otic ganglion is intimately related to the glossopharyngeal nerve. From its origin, and now I am talking about the cause of the glossopharyngeal nerve, and you must know the cause. From its origin in the medulla oblongata, the glossopharyngeal nerve passes forward and laterally towards the triangular depression into which the aqueduct cochlea opens in the inferior surface of the petrous part of the temporal bone. It lies initially under cover of the flocculus and rests on the jugular tubercle of the occipital bone. And in postgraduate examination in our days, we are asked to talk about causes of the nerve. And as part of the course, from its exit as it leaves the skull, by bending sharply downwards through the central part of the jugular foramen, being in this location, anterior to the vagus nerve and the accessory nerve, in a separate sheet of dura mater. It is in a separate sheet of dura mater. It is actually separated by the inferior petrosal sinus from these two nerves, that is, from the vagus and the accessory nerve. And I just want you to concentrate on three nerves here. The glossopharyngeal nerve with its superior ganglion and the petrous ganglion. And the distribution and connection with the vagus nerve and also the branches of the glossopharyngeal nerve to the auricular and the tympanic region. Also, look at the vagus nerve with its jugular ganglion and the nodosal ganglion. And then my very friendly accessory nerve. After it exits from the skull, it passes between the internal jugular vein and internal carotid artery. You see, it mingles around a lot of anatomical structures. It then lies upon the stylopharyngeus and then pierces the lower fiber of the superior constrictor of the pharynx. And it is strange, it pierces the lower fibers of the superior constrictor of the pharynx without supplying it. Just imagine that. We're going to look at the communications of the glossopharyngeal nerve now. The glossopharyngeal nerve communicates with the sympathetic trunk and with the vagus and facial nerve. The inferior ganglion is connected by a filament with the superior cervical ganglion. Further in its course, the glossopharyngeal nerve perforates the posterior belly of the digastric and joins the facial nerve near the stylomastoid foramen. It joins the facial nerve near the stylomastoid foramen. The branches of the glossopharyngeal nerves are worthy to be praised. The tympanic nerve, which supplies the mucous membrane lining the tympanic cavity, the auditory tube, and the mastoid ear cells. The plexus of this nerve gives off the lesser petrosal nerve. A branch of this nerve forms the greater petrosal nerve. Now, we're going to concentrate on the lesser petrosal nerve, which contains the secretomotor fibers for the parotid gland, and it passes through the foramen ovale and then joins the otic ganglion. Other branches will include the carotid branches, the pharyngeal branches, and the muscular branches. And I've told you previously that this muscular branch is solely to the stylopharyngeus muscle. The pharyngeal branch supplies the mucous membrane of the pharynx with sensory branches, and the carotid branches distributed to the walls of the carotid sinus and carotid body. And I keep on showing you this illustration because I want you to appreciate the distribution of the glossopharyngeal nerve, particularly the otic ganglion, the parotid gland, which is in red, and you can see how very close to the inferior ganglion, the inferior petrosal nerve takes a journey. I call it hitchhikes onto the parotid gland via the otic ganglion. So it doesn't go to the parotid gland directly, as you can see in the dotted reds. It goes to the otic ganglion first and then goes to the parotid gland. The tonsillar branches are also important. And then the lingual branches supplies the valate papilla and the mucous membrane near the sulcus terminalis of the posterior aspect of the tongue. The other branches supply the mucous membrane of the posterior part of the tongue. So I want you to read up on the otic ganglion and answer some questions which, well, basically it's an essay question, but we don't ask you to write essay question. I want you to explain the relations and function of the otic ganglion. Okay? We're going to look at the accessory nerve. This nerve is formed by the union of the cranial and the spinal root, but these constituent parts are associated with each other only for a very short part of their course before the cranial part joins the vagus nerve and then distributed through the vagus nerve its branches. So this is a very funny nerve. Huh? It distributes its branches through the vagus nerve. The cranial moiety, that is the cranial part of this nerve, should therefore be considered as a part of the vagus nerve. But anatomy refuses to change, so it is still what it is 200 years ago. The function of the accessory nerve, the cranial moiety, is a branchial or special visceral efferent nerve in constitution. The spinal root may be either somatic It could be special visceral afferent or mixed, depending upon the views taken of the evolutionary origin of the sternocleidomastoid and the trapezius, which this nerve supplies. So I have stylishly told you that the accessory nerve supplies two muscles, the sternocleidomastoid and the trapezius muscle. This controversy relating to the cranial moiety of the accessory nerve is not likely to be solved. The cranial root is smaller. Its fibers arise from the cells of the lower end of the nucleus ambiguous and possibly from the dorsal vagus nucleus. The root runs laterally to the jugular foramen, where it is said to interchange fibers with the spinal root, with which it becomes united for a short distance. The spinal root is a larger one. It arises from an elongated column of motor neurons. The spinal nucleus, which is situated in the lateral part of the anterior gray column of the spinal cord. It extends downwards as low as the level of the fifth cervical segment. This nerve enters the skull through the foramen magnum behind the vertebral artery. It is then directed upwards and laterally to the jugular foramen, through which it passes in the same sheet of dura mater with the vagus nerve. So I'm reminding you that it is in the same sheet as the vagus nerve. And this sheet is different from the sheet in which the glossopharyngeal nerve is encased. All right? We're going to look at the anatomy, the applied anatomy. The function of the accessory nerve may be interfered by central changes or at the exit by fracture running across the jugular foramen, or in the neck by inflamed lymph nodes. And you could have acute torticollis in children, which is the most commonly reason for inflamed lymph nodes. Central irritation causes chronic spasm of the sternocleidomastoid and trapezius. During neck dissection in the posterior triangle, for clearance of malignant lymph nodes, it is important to identify the nerves at the onset and preserve its continuity. And this is just to diverse and digress a little bit about neck dissection with cancer of the tongue, cancer of the oral cavity. And, you know, I am an advocate of not doing neck dissection. I irradiate the neck, you know, and I was in a center where the ENT surgeon loved to dissect the neck. And of course, most of the patients end up dying. The nursing care is very expensive post-operatively. So I found it very easy to remove the primary tumor in the mouth and then send the patient to radiotherapy for irradiation of the neck. And my patients have had long-term survival. I like the hypoglossal nerve, and I'm going to be very brief about this. The hypoglossal nerve is a motor nerve of the tongue. It represents the fused ventral roots of probably 4 pre-cervical or spinal occipital nerves, the dorsal root of which have disappeared entirely. Its fibers arise from the hypoglossal nucleus, and which is in line with the modified anterior gray column of the spinal cord. This nucleus is about 2 centimeters long, and its rostral part corresponds with the hypoglossal triangle in the floor of the fourth ventricle. The connections of the hypoglossal nerve. The nucleus of the hypoglossal nerve receives fibers from the precentral gyrus and adjacent areas of mainly the opposite cerebral hemisphere through the corticonuclear tract. The hypoglossal nucleus may also be connected with the cerebellum, medullary reticular formation, the sensory nuclei of the trigeminal, and the nucleus solitarius. Now, it is important, as we dealt with the cause of the glossopharyngeal nerve and the cause of the accessory nerve earlier on, that we'll talk about the cause of the hypoglossal nerve. It runs laterally behind the vertebral artery, as I mentioned earlier on, to be collected into 2 bundles which perforate the dura mater separately opposite the hypoglossal canal in the occipital bone. On emerging from the hypoglossal canal, that is, this nerve emerges from the brain through the hypoglossal canal, the nerve lies on a deeper plane, then the internal jugular vein, and then the internal carotid artery, and then the 9th, 10th, 11th cranial nerve. And let me go again. On emerging from the hypoglossal nerve, the nerve lies on a deeper plane than the internal jugular vein and all these other structures. That is the internal carotid artery, the 9th, 10th, 11th cranial nerves. It passes laterally with a downward inclination behind the internal carotid artery and the glossopharyngeal and vagus nerve to gain the interval between the internal carotid artery and the internal jugular vein. So at a point, or at this point, it is between the internal carotid artery and the internal jugular vein. Now, I like arrows, and I'm going to use the arrow to depict the course. In this part of its course, it makes a half turn around the inferior ganglion of the vagus, to which it is united by connective tissues. It then descends almost vertically, lying between the vessels and in front of the vagus nerve to a point corresponding to the angle of the mandible. It then becomes superficial below the posterior belly of the digastric, emerging from between the internal jugular vein and the internal carotid artery. The nerve then loops around the inferior sternocleidomastoid branch of the occipital artery. It crosses the internal and the external carotid artery, and then the loop of the lingual artery, a little above the greater horn of the hyoid bone, being itself crossed by the facial vein. It inclines upward as it runs forward on the hypoglossus, passing deep to the tendon of the digastric, the high stylohyoid, and the posterior border of the mylohyoid muscle. It is then related to the deeper part of the submandibular gland, the submandibular duct, and the lingual nerve. It is important that we talk about the communication of the nerve. The hypoglossal nerve communicates with the sympathetic trunk of the vagus, the first and second cervical, and the lingual nerve. Now, you must understand what the ansa cervicalis is. And I also want you to check the following branches of the hypoglossal nerve: the meningeal, the descending branch, the nerve to the thyroid, and the muscular branch. Now, these are some multiple choice questions, and I hope that they will help you. This one relates to the glossopharyngeal nerve, and they are true or false. We don't ask true or false questions anymore. This one also is true or false, and it relates to the glossopharyngeal nerve. And this question 3 relates to the otic ganglion. It is also a true or false style question. And this question here, question 4, relates to the accessory nerve. It is also true or false. So the way to use it is for you to reference to Gray's anatomy, all right? And the 5th question here is in relation to the hypoglossal nerve, and it is also true or false. Now, let us talk about the vagus nerve. This is the 10th cranial nerve, and it has both motor and sensory fibers, and this is the last nerve we're talking about. More extensive course and distribution than any of the cranial nerve, as it passes through the neck, the thorax, and abdomen. Can you imagine? From the skull, it passes through the neck, the thorax, and the abdomen. And let me be quick to tell you that the distribution of the vagus nerve on the left side is different from the distribution on the right side of the body. So this is the distribution of the vagus nerve. You can see the parasympathetic distribution on the left side of the screen and the sympathetic distribution on the right side of the screen. Now, the vagus nerve, it is attached by 8 or 10 rootlets to the medulla oblongata between the olive and the inferior cerebellar peduncle. The fibers of the vagus nerve are connected to 4 nuclei in the medulla oblongata. And these 4 nuclei include the dorsal nuclei, the nucleus ambiguus, the nucleus of the tractus solitarius, and the spinal nucleus of the trigeminal nerve. Now, from the exit from the skull, it leaves the cavity through the jugular foramen, being accompanied and contained in the same sheet of dura and arachnoid matter as the accessory nerve, with the glossopharyngeal nerve intimately related to them, but is separated from them by a fibrous septum. At its exit from the jugular foramen, the vagus nerve presents with an enlargement called the superior or the jugular ganglion. A second swelling, called the inferior nodosal ganglion, is formed after the exit from the skull. The vagus nerve passes vertically down the neck with the carotid sheath lying between the internal jugular vein and the internal carotid artery as far as the upper border of the thyroid cartilage. Further down, it then passes between the jugular vein and the common carotid artery until it reaches the root of the neck. The further course of the vagus nerve then differs on the two sides of the body. So it is symmetrical up to the root of the neck in its course and distribution. And after this, it is different. We're going to look at the branches of the vagus nerve. In the jugular fossa, you have the meningeal and the auricular branch. In the neck, you have the pharyngeal branch to the carotid body, the superior laryngeal and the recurrent laryngeal, and the cardiac. In the thorax, you have the cardiac, recurrent, laryngeal, the pulmonary, and the esophageal. In the abdomen, you have the gastric, the celiac, and the hepatic. So these are branches in the neck, and the branches in the thorax, and branches in the abdomen. And this is a schematic diagram of the distribution of the vagus nerve. And this brings us to the end of a synoptical lecture on the glossopharyngeal nerve, the accessory nerve, the hypoglossal nerve, and the vagus nerve. Thank you.